All right, we do begin this morning, though, with these startling COVID numbers. Once again, more than 1 million Americans tested positive over the past 24 hours.
This is the fourth day in a row the U.S. has reported more than 1 million new cases. That has never happened before, and that means that more than 4 million Americans have been infected since just Sunday. As for the overall total, within the last 2 years, more than 63 million people in the U.S. have had or currently have COVID. As the Omicron variant spreads out of control, the White House is now trying to address questions about masks and testing. They've hired a testing coordinator and are considering a plan to make more high-quality masks like N95s available to everyone. But will it be enough to ease the burden of the nation's hospitals right now? 15 states plus Washington, D.C. say COVID hospitalizations have more than doubled in the past 2 weeks. Some are seeing patient numbers they haven't seen at any other time during the pandemic. NBC News correspondent Josh Letterman joins us now. Josh, President Biden is planning to give an update on his administration's COVID response later on this morning. So what can we expect, especially when it comes to these high case numbers and growing number of hospitalizations?
Yeah, Joe, the president will be speaking after he gets a briefing on the latest of COVID-19. He will be alongside the Defense Secretary Lloyd Austin, as well as the FEMA administrator. And we are learning from a White House official that part of what President Biden plans to talk about today is the deployment of military medical teams to 6 hospitals across the United States. This is part of something that Biden had announced in December. He would be sending up to 1,000 troops to help with overwhelmed hospitals. And at the time, the Pentagon said those teams would only be sent this year if they were needed. Apparently, they are needed because President Biden is now deploying the first 6 of those teams. They will go to the famed Cleveland Clinic in Ohio, Coney Island Hospital in Brooklyn, Providence's Rhode Island Hospital, Detroit's Henry Ford Hospital, the University of New Mexico in Albuquerque, and University Hospital in Newark, New Jersey. And the White House says more teams such as these will be deployed throughout the rest of this month and next month as they see where the biggest needs are around the country with this Omicron surge really spreading across the nation, Joe.
We're going to take an in-depth look inside one of those hospitals, Cleveland Clinic, in just a moment. Josh, let's talk about testing. Yesterday, the White House unveiled a plan for testing in schools and announced a testing coordinator. But a lot of people are still wondering where they can even get tests. The president said last month they'd be launching a website where people can request free tests. It's still not here. So where is it? What's the White House saying about that?
Well, the White House says that they are expecting to take the first delivery of these tests that they have now signed contracts to purchase within the next week or so. We're also hearing from Tom Igglesby, the new White House testing coordinator, who told PBS they could have that website up within days. We have not gotten to see that website yet. There is a long history of healthcare websites built by the federal government not working terrifically when they first get rolled out. So I think there are a lot of questions about whether that's going to be able to handle the really surge of possibly tens of millions of Americans, just like we saw the government struggle when they had to give out those coronavirus stimulus checks to come up with websites and systems for that. But the White House says they are on track. They are defending their decision to have these tests really just rolling out at the end of this month, despite the Omicron surge we've been seeing since December, saying they moved as quickly as possible to respond to this really massive surge in demand for tests that we're seeing across the country.
Josh Letterman in Washington. Josh, thank you.
Now, we do have some positive news from the CDC. A study found the Omicron variant, which now represents 98% of cases across the country, does in fact carry less risk of serious disease than the previously dominant Delta strain. Still, hospitalizations are up, so are deaths. But the CDC director says most deaths are still due to Delta. So what's it look like right now on the front lines? NBC News senior national correspondent Kate Snow got exclusive access to the largest medical ICU in the country at the Cleveland Clinic.
How does the situation right now compare to last year?
We have more patients. Our patients are sicker. Our teams are tired and exhausted, too.
In a COVID ICU unit at the Cleveland Clinic's main campus, 25 patients struggle to hang on. As soon as one recovers or dies, another moves in.
We're seeing patients in their 20s, in their 30s, in their 40s.
Good morning.
Nurse Tim Washington came on at 7 a.m.
First thing I did is kind of look in the room to see if my patients were still there.
Still alive.
Still alive, right.
And they are today.
They are today.
Most patients here are on ventilators. 90% are unvaccinated.
Do you personally feel anger? What do you feel?
If I say I didn't feel anger, I would be lying, because this can be prevented with vaccinations.
There was some good news. A new study from Southern California finding the Omicron variant is less likely to lead to hospitalization, ICU admission, or death than the Delta variant.
Those infected with Omicron who were hospitalized had a shorter duration of hospital stay.
But the sheer volume of Omicron cases is straining the system. At the Cleveland Clinic, 5% of the staff is also out sick. National Guard were called in to run testing centers, clean, and deliver meals. Respiratory therapist Myron Drisson used to be assigned to 8 patients. Now he'll sometimes cover 17.
When that alarm clock goes off in the morning, it's a little bit, here we go again.
People come to the Cleveland Clinic from all over the country for specialty services or surgeries. But right now, because of the COVID situation, no elective surgeries until at least January 30th.
That's actually the rationing of care.
Nationwide, ICUs are 82% full, a pandemic high. Dr. Hassan Cooley, who heads critical care at the Cleveland Clinic, says if their ICUs grow more crowded, it could be devastating.
I guess this is a morbid thought, but does that mean that somebody that comes in with a heart attack might end up dying because they can't get into your ICU?
That is possible, or they would wait in the emergency room, waiting for a bed in the intensive care unit, or they may be actually crashing on the floor.
In the COVID unit, 73-year-old Ron Perelka is vaccinated but not boosted. He has an underlying medical condition.
I'll tell you, I was the last one to think that I would get it.
What would you say to people who think that Omicron is mild and it's no big deal?
I'm willing to go walk out the door and they can come and sit in here and see what it's like.
He was one of the only ICU patients even able to speak. Kate Snow, NBC News, Cleveland.
Let's bring in NBC News medical contributor Dr. Kavita Patel. So, Dr. Patel, let's start with kids. Vaccination rates still low among children, especially those as young as 5. What is your message to the parents out there who are concerned because they say this is still a new vaccine? They're worried about potential side effects on kids. What's your message?
Yeah. 2 points, Joe, to reassure parents. Number one, that we now have had millions of children in the 5 to 11 age group who have been vaccinated. And the time period where we would expect to see any serious or significant side effects has passed. And we're happy to report that this is a very safe and effective vaccine. Second point, children are getting COVID. And the most cases that we're seeing in hospitals and clinics are unvaccinated children. So we can protect them. That's the basic point. Come in with questions. We have answers. And there's no judgment here, but please get vaccinated.
Speaking of questions, we asked our viewers to submit some of their questions. We quickly heard back. One viewer, Maria, says she's vaccinated, wants to get the booster, but tested positive for COVID this week. She wants to know, how long do I wait before getting my booster? So what do you say to Maria and the many others out there who are in a similar position?
Yeah, good news. You do not need to wait to get your booster. We recommend you finish your isolation period. So we're still recommending 10 days if you are testing positive. And then as soon as that isolation period is up, you can get your booster. There's no reason to worry about it or delay.
All right, Dr. Kavita Patel, thanks so much. And if you have a question for one of our doctors who we have on here every day, let us know, whether it's about the variant, the vaccines, or masks. We want to get questions straight from you right to our doctors. You can email us at morningnewsnow@nbcuni.com with your questions. You can also let us know if you want to stay anonymous.
Now to new developments this morning in the investigation into the insurrection at the Capitol. This morning, the top House Republican and longtime Trump ally Kevin McCarthy says he will not cooperate with the January 6th Select Committee investigation, saying he would refuse to voluntarily give up information regarding his communications with the White House surrounding the attack. NBC News Capitol Hill correspondent Leanne Caldwell joins us now with more on this. Hey, Leanne, good morning. So McCarthy is now the third Republican representative who said they won't comply with this investigation, and obviously someone with close ties to President Trump. When we've seen other witnesses, though, refuse to cooperate, the committee hasn't been afraid to push back, issuing these subpoenas. Is the committee considering a subpoena in this case?
Good morning, Savannah. They are considering a subpoena, but it's also much different because these 3 people, they're members of Congress, and there is a lot of barriers to cross. They don't want to set a precedent for members of Congress subpoenaing other members of Congress. This is something that's not unheard of, but it is extremely rare. And so the committee is moving very cautiously and hoping these members, including Kevin McCarthy, Representative Jim Jordan of Ohio, and Representative Scott Perry of Pennsylvania, do in fact cooperate with the committee. But it is now in the committee's hands to determine what they're going to do. And I'm told, especially from that the committee has not spoken to Representative Jim Jordan since he sent a letter saying that he was unlikely to cooperate on Sunday. Savannah.
Now, Leanne, McCarthy had previously said he would be willing to discuss a phone conversation he had with the former president as the riot was unfolding. What happened to that? What is he saying about his decision to not cooperate here after having previously said something like that?
Yeah, now he says he's not going to cooperate. He calls the committee illegitimate. And in a statement that's about 3 paragraphs long, he says that as a representative of the leader of the minority party, it is neither with regret nor satisfaction. It is with regret. It is with neither regret or satisfaction I have concluded to not participate with the Select Committee's abuse of power that stains this institution today and will harm it going forward. And so the leader has a lot of political things to think about as well. Of course, he wants to be Speaker of the House should Republicans gain control of the House in the 2022 elections. And he needs the support of Donald Trump and his supporters in order to do that, and the members of Congress who support the former president. So McCarthy's in a very, very difficult place right now. And as of now, he's taking a very hard line.
All right, Leanne Caldwell, always great to see you. Thanks so much.
Yep.
Nearly a year into their administration, Vice President Kamala Harris and President Joe Biden are facing a number of challenges, many of them driven by the pandemic.
Yeah, well, today's show anchor Craig Melvin just sat down with her for an exclusive interview to discuss those issues and the criticism that's been leveled at the White House.
As we sit here this week, we saw a record number of hospitalizations, adults and children. We've seen the infection record broken. I think a lot of people are scratching their heads and they're wondering, 1 year into this administration, why aren't we doing better in the fight against COVID?
So let me start with saying that people are rightly frustrated with where we are. We're frustrated. We're all frustrated. But I think it's a mistake, and it would be a mistake to suggest that we've not seen great progress. If you think back to March of 2020, we were all wiping down the boxes that we got if we ordered things online. There was no vaccine. Now we have a vaccine, which has proved to be effective, and boosters. Now we have our children back in school. 95% of schools are back open. But we're building back up, we're opening back up, and we are not where we were a year ago.
Let's talk about masks for a second. It's been several weeks now since public health experts have acknowledged that cloth masks, surgical masks, they're not as effective in terms of stopping this new variant, Omicron. Should Americans be wearing KN95 masks or N95 masks?
Well, the CDC is going to be providing us with those guidelines.
But what's taking so long?
Well, the CDC is making their decisions. I don't make the CDC's decisions. But what I will say is what has been clear about the masks is you want to wear a tight-fitting mask. That is clear, and we want to urge everybody to do that. In terms of the N95 masks, they are available. There is a stockpile of, I believe, over 700 million of those masks. So the supply is there as necessary and as needed.
At what point does the administration say, you know what, this strategy isn't working, we're going to change strategies? 6 former administration officials last week wrote that open letter urging the administration to change course, to change strategy. Is it time?
It is time for us to do what we have been doing, and that time is every day. Every day it is time for us to agree that there are things and tools that are available to us to slow this thing down. And so right now we know we still have a number of people that is in the millions of Americans who have not been vaccinated and could be vaccinated, and we are urging them to get vaccinated because it will save their life.
At what point does the administration acknowledge these people aren't going to get the shot? They're just not going to do it.
I don't believe in giving up on people, Craig. I really don't.
The 500 million tests that have been ordered that are going to be sent to every American, do we know when those are going out?
Shortly, though they're going to go out shortly. They've been ordered. They've been ordered. I have to look at the current information. I think it's going to be by next week, but soon, absolutely soon, and it is a matter of urgency for us.
Should we have done that sooner?
We are doing it.
But should we have done it sooner?
We are doing it.
Let's turn to voting rights here for a moment. You were there in Atlanta with the president when he compared those who oppose Democratic-backed voting bills that are currently in the Senate. He compared the folks who oppose those to folks who oppose civil rights. Senator Romney, in response yesterday, he took to the floor of the Senate and he said, quote, "So much for unifying the country." When the president was on the campaign trail in the fall of 2020, he said something. He said, "With Trump out of the way, the vindictiveness of a president going after Republicans who don't do exactly what he says gets taken away." Isn't that exactly what President Biden did in Atlanta on Wednesday?
President Biden took the, I believe, right and courageous step to say that Senate rules should not get in the way of protecting the American people's access to the ballot. And he compared this time to a previous time in our history, which is apt for comparison.
It's not just Republican opposition. It would seem as if this piece of legislation is going to come down to one or two moderate Democrats. In months and weeks, the administration hasn't been able to convince one or two senators to come around. How are you going to do that in 2 or 3 days?
If I may, I'd like to contextualize this conversation.
Sure.
Which is, in 2006, in this very town of Washington, D.C., up the street at the United States Capitol, in the United States Senate, 98 of the 100 members of the United States Senate voted in favor of an extension of the Voting Rights Act. It was not a partisan issue. It was an American issue.
But, Madam Vice President, how are you going to get it done?
Well, when we have the discussion about who's responsible, I will not absolve the 50 Republicans in the United States Senate from responsibility for upholding one of the most basic and important tenets of our democracy, which is free and fair elections and access to the ballot for all eligible voters.
What about Senator Manchin? What about Senator Sinema?
I don't think anyone should be absolved from the responsibility of preserving and protecting our democracy, especially when they took an oath to protect and defend our Constitution.
Why has the administration not been able to get Senate Democrats on board?
We are not giving up.
No, but the question was, why has it taken this long?
But you're acting as though it's over.
Well, I mean,
It's not over.
So it's going to happen by Monday?
I'm saying it's not over, and we don't give up. We don't give up, and we will not give up.
Are we going to see the same Democratic ticket in 2024?
I'm sorry, we are thinking about today. I mean, honestly, that I know why you're asking the question, because this is part of the punditry and the gossip around places like Washington, D.C. Let me just tell you something. We're focused on the things in front of us. We're focused on what we need to do to address issues like affordable child care, what we need to do to ensure.
So there have been no conversations about 2024?
The American people sent us here to do a job. And right now there's a lot of work to be done, and that's my focus.
It sounds
sincerely.
Like you're at least familiar with some of the punditry. I don't know if you've heard that there's been some talk about a Biden-Cheney ticket perhaps in 2024. Did you read that article?
I did not. No, I did not, and I really could care less about the high-class gossip on these issues.
All right, fantastic interview there from our Craig Melvin. Thank you so much for that exclusive interview, actually.
And let's get a check now on your morning news now weather. NBC
News meteorologist Bill Cairns, of course, joins us with the latest on that major storm that's expected to impact millions in the U.S. coming up. Bill, what do we got?
Yeah, there's millions of people paying attention to this forecast. It is going to impact a lot of you. So this storm, not today. It's up in Canada. It's on its way. But today is our day to kind of just take a deep breath, see what we have to prepare for in the days ahead. It's a pretty nice forecast around the country. Nothing too cold, nothing too wet, not too bad. So let's get into the storm. This will be our biggest winter storm of the season. It's going to start in North Dakota, and then it's going to drop down into the Central Plains as we go throughout Friday morning. So we already have winter storm warnings up in the areas of red. We have winter storm watches in blue. And tomorrow morning, when I show you the same map, we'll include a lot of the south and even into the East Coast. So here's how it's going to play out. Remember on these maps, the blue shows you where the snow is. The pinkish shading, peach color, that shows you where the icy mix is. So that's kind of where it's going to be kind of messy Friday evening. Kansas City, Columbia, all the way through St. Louis and Interstate 70. A good snowstorm for areas of Iowa, especially Sioux Falls included in that, and Des Moines and Ames. So the snow totals, this is just out through Saturday morning, does show at least 4 to 8 inches. That's a plowable snow, good for the kids, but difficult travel there, Iowa and also Minnesota. And then let's take this storm Saturday morning. It dives all the way down to the Gulf Coast. We could see some snow and icy problems from Oklahoma City to Tulsa, or just north of Little Rock. And then Saturday night into Sunday, a snowstorm through especially Kentucky, portions of Tennessee. An ice storm is likely in areas of the Carolinas, maybe even a crippling ice storm. Be careful, watch that from Charlotte northwards to Roanoke. And then Sunday night into Monday, a burst of snow followed by sleet and rain up through the I-95 corridor. The heaviest snows right now appear likely to be inland, north and west of I-95, so not for D.C., New York, and Boston. You'll get some snow, but the really blockbuster totals will be out towards Pittsburgh, Rochester, Syracuse, possibly Albany, and interior sections. So this is going to be a big one, guys, and we'll pinpoint the snowfall totals tomorrow a little better for you. But as of now, it looks like the big cities along the East Coast, this will not be a huge snow event for you. It'll be a mess.
This thing looks like it's just taking a tour of the United States. Like it just wants to see every little part of it.
It is. It will.
Thank you, Bill.
Thanks for watching our YouTube channel. Follow today's top stories and breaking news by downloading the NBC News app.